Hi, this is Dr. Mustafa Parekh, going to be talking about Beginner's Guide to Buttery Smooth dmek graft preparation. This video hopefully is going to be useful for beginner doctors, surgeons, eye surgeons, corneal surgeons, and eye bank technicians. You're going to be placing the graft with the endothelial side up, and this is going to be a Teflon block, or simple to say. What is very important is the donor graft, what you're going to be selecting should be of the age 50 to 75 years. Avoid cataract surgery, cell count 2400, diabetes mellitus, and prolonged eye disease patients are to be avoided. For the procedure overview, have a good clean OT. Microscope is important, Teflon block. You need to have Sinski hook and suture tying forceps, and you will need to have wax punch and 3 mm skin punch tissue markers. This is your measurement of your graft. It's a 12 mm, so you're going to be using a 9.5 munch. Caretaking, you are not going to have any slippage when you're marking it, so tissue stabilization is important. Trypan blue is used for a minute, and here you can see a very nice round mark, 150 micron is the appropriate depth, which is important. So once you've marked it, now what you need to do is, what we are going to do is now score around all this 360 degrees. You're going to be, and what we have in our right hand is a Sinski hook. You're going to stabilize with your left hand the graft with 1/2 forceps, and you start scoring. Here you can see there's a separation happening all around. Smoothly you're going to be moving along the edges, and here you can see you're getting a peel. You're rotating the graft clockwise and you're moving anti-clockwise. So graft, as you describe it as like a wall clock, 12 o'clock, 3 o'clock, 9 o'clock and 6 o'clock. Again repeating, you're going to be holding the graft with your left hand and gently scoring and separating. Care to be taken, you don't go too deep into the stroma, and it has to be superficial enough. Here what you can see with the right hand, we are separating and then gently 2 clock hours and moving with your left hand. So your right hand is stabilized, it's not moving, it's working between 10 to 12 o'clock, and same is with your left hand, which is quite stabilized and which is allowing the graft to move. This is a work of patience. You need to have a lot of patience. Now yes, you can see it. The moment you're going to be doing it, we are going to be removing the graft and moving ahead. Since that scrolling has happened, what we are going to do is we are going to be peeling it and removing. We have removed the 1/2 forceps and we have taken the plain forceps, removed the graft which is stored, and we'll continue dissecting further. You need to use a less heavy hand. Patience very important. Gently you're sweeping and tugging it, just a millimeter. Avoid the iris tissue, short overlap. Keep rinsing the tissue. The tissue needs to be wet, so it's always under the saline. Separate, move, rotate, separate. Tug, slight tugging movement, tugging it down towards the center. Here you're sweeping it across. Once your sweeping and separation is done, then you're going to do a gentle tug, a millimeter, and care taken. You're not going to involve when you're tugging it. Here we are working with a little lower magnification. We have done the scoring. Again, reinforcing all 360 degrees. Suppose in cases where you would not be able to do it with Sinski, you can use a 30 gauge needle made like a cystatome, or you can also use a phaco chopper probe to do a tough dissection which cannot be scored. So these are the options one can keep it ready with us. Now here you can see once we have done the scoring with the Sinski, we're just gently sweeping it. We are not doing any dissection, and we are just doing a gentle sweep and separating it. During this movement you need to be careful that you don't develop any of the radial tears which are important. Once the scoring is done, now we are coming to the stage of peeling it. You're holding your forceps with the left hand, and with your right hand you will have a suture tying forceps. Here what you need to do is, before when you're holding it, you need to hold it in the center. You're peeling it, your forceps should cross over the center hole which is there. Once you're coming at the equator, this is the area where you will have maximum tension which is there, so you need to be very careful during this dissection. Once the equatorial dissection is passed over, then it's quite simple. You're going to be peeling it until 80% of the peel is done, and allow it to stop. Now you can take a deep breath and relax. You put in the dissection. Now I'm going to repeat and going to be highlighting the point. What we are going to be highlighting is how do you hold the graft, your pressure at 12 o'clock, counter pressure, and here what you can see is with the left hand I'm also sliding the tissue a little up when you are going at the equator, so you can see the graft. You can, if you're concentrating on the center spot, you can see I am moving both my hands. My left hand is pulling the graft up and my right hand is continuing the dissecting and the gentle. So what happens is with this, you have a counter traction which is also helping you in your dissection. Once the dissection is done, you will want to unfold the graft back with the saline. Here what we have done is we have left the graft because of the iris tissue, so you've got a little bit of use a lot of fluids and unroll it back. You have a successful peel now. Yeah, now the peeling is done already, and what we'll now do is retrace the flap back very gently, fill it open. Once the punch is complete, then what we'll do is on the scleral side, you'll make a V-shaped cut to indicate where your graft is attached. Your peeling punch is all complete and you're ready for the next case. Thank you very much.